How you guys doing? My name is Luther Glover.
And I'm Lizzie.
And today we will be talking about a dislocated kneecap.
So with a dislocated kneecap, a couple of the things you want to really focus on at first is keeping your range of motion and get the swelling down. So immediately after it happens, you will have a lot of swelling. So doing ice and compression will be a great way to help reduce a lot of that swelling. So the way you have a dislocated kneecap is typically either from trauma to the knee, like a blunt force, or an agility type move where your quad kind of takes over and pops that patella or that kneecap out of place. So we're going to show you a few exercises today that will be kind of the beginning phases of working on a dislocated kneecap. So we're going to head over here. I'm going to put Luther up to the test and we're going to work on range of motion first. So I'm going to have Luther put his leg over here. He's going to stand like this. And then we're going to work on flexion. So it's going to be challenging to get flexion and extension back with that knee after you've had a dislocated kneecap. So what he wants to do is just gently press into that motion. So going into flexion of the knee, bending that knee. And you want to push it until you feel like it's starting to get pretty tight. And just keep going through that range of motion. I would go through like 20 to 30 reps of that or spend a couple minutes working through that range of motion. Feel okay?
Feel good.
All right, next one is going to be extension. So just the opposite of that. The knee really only does flexion and extension. So you can simply just step back and put your leg up, just like that. And then it's gonna kind of stretch that hamstring as well. But you just wanna let this gently stretch into that extension. You can also tighten your quad, so it's called a quad set, and you'll see that patella gently glide up, that kneecap move up, and that will help push it a little bit further into extension. All right, and then Luther's gonna take us through the next exercise.
Okay, guys, so what we got next is this is for more stability. Once you get all the swelling gone, as Lizzie said, that's the biggest thing, getting swelling inflammation down. So what we're gonna do is we're gonna put her on an unstable surface, and what we're gonna do is have her do a body weight single leg RDL. And the reason for, again, is for stability, coordination, balance, because once something like this traumatic happens, she's going to go straight down to the front, back up, to the left, back up, and to the right. And the reason why she's doing this is to get that balance back that she lost. Taking a injury like this, it throws everything off your equilibrium. And so this is a great exercise to do as far as rehabbing the kneecap after this type of injury.
Yeah, so like he said, the balance is going to be pretty disrupted after you've had any sort of injury to the knee, so super important to get that back. The last exercise we're going to show you is just a simple single leg raise. So I'm going to have Luther sit on the floor. And what we're going to do is you want to be able to raise this leg up without any extension lag. So that means any bend in the knee as you raise it up. This is really good for quad strength as well as knee stability and hip stability too. So what he's going to do is he's going to tighten this muscle. You'll see that kneecap again slide up, and then he's just going to raise it up to be even with this leg and back down. And then as he comes down, he's going to relax that quad completely and then reset. So each time you're doing a quad set, getting that quad firing, super important for that knee health. We'll do one more here. Raise it on up.
And guys, remember, you want to make sure you're doing this slow and controlled. Nothing fast, nothing, it's not a type of movement nor exercise that you need to go super fast to rush through it. You're going to make sure you're coming down, contraction, focus on the contraction.
That's right. All right, you can stand on up here. So once you get that one under control, say you do like 3 sets of 12 to 15, then you want to start to increase the weight, and then that's when you really want to get into the other strengthening exercises. So these ones here are just the beginning phase of right after you've had a dislocated kneecap, but then you want to start training it into more advanced techniques as well. All right, guys, so that was over dislocated kneecap. Again, we went over just the things you want to look out for as far as range of motion and swelling, exercises you can start with right away, and then some things to keep in mind for when you start to do more advanced techniques. I'm Lizzie, and my practice is in Novo Physical Therapy.
I'm Luther with Luther Glover Workouts.
And stay tuned for our next videos.